I realized I came this morning and I didn't bring the actual mask. It's on my hotel bed, all ready to ring and looking very nice. But there's lots of pictures, so you'll soon get the idea of what it's about. So I'm the CEO of PolyPhotonix. I've been in printed electronics a long time, about 20 years, but developing this mask for about the last 10 of those. And it's taken a long time to get here. It's a medical device. So any clinical trial we do takes 3 or 4 years. We have to do the evidence and all of those things. So it's taken about £20 million and a good part of 10 years to get to this point. Now that should work, but it isn't. So I'll go to this. I can't see the buttons. You know if that works? Oh, there we go. There we go. We're working. Great. So this is what it looks like. It's a mask. It's very simple. These are the emitters. They're OLEDs. And what is it? It's a treatment for diabetic retinopathy, which is one of the most common causes of cancer, one of the most common causes of blindness in the world. In the Western world, we have some very potent drugs, mostly injections directly into the eye, which are incredibly unpleasant anyway. But in many parts of the world, Brazil, for example, Mexico, large parts, well, in China, you go blind with this disease because the drugs that are available are simply too expensive. So it used to be the most common cause of blindness in the Western world as well, up until about 10 years ago. So it's a big deal. And how do we do that with light? Well, it's a really clever science. It's something that we could put on the back of an envelope and understand very, very quickly, but it's taken many years to actually get to the point where we're able to prove it. The mask is clever in the sense that it actually records patient data, and I'll come back to that in a minute. But we have about 2 million hours of patient use now, so we've captured a lot of data. And about 9,000 of these masks are supplied up to over 2,000 patients. And it's incredibly effective. It's more effective than we dared hope. And the more patients we get, the more information that's coming through, the more we see how effective it is. So, diabetes. A lot of people think you can live with diabetes, and it's just one of these diseases that you know, it becomes part of your lifestyle. It's actually a terrible disease, and it's only going one way. So even with the GLP-1 drugs, Ozempic, Wegovy, all of these things, it's not going to really change. It's a massive problem, and we're looking at about 530 million people with that globally. And what is it? So this is, well, there's 2 types of diabetes. That's where we start. We have type 1, which is a kind of hereditary diabetes. Generally, people are diagnosed in their early teens or late teens. And we find that type 1 patients tend to be highly educated about their disease. They know what's going to happen. And you can be the most highly regulated type 1. But if you live with type 1 diabetes, you're going to develop this disease. And about 90% of type 1s develop the disease eventually. You can't escape it. The other type of diabetes is type 2, and this is lifestyle, sedentary lifestyle, sugar. And about 2/3 of people with type 2 will develop this disease within 10 years of diagnosis. So again, it's a bad disease. And what happens is we get a thickening of the retina, and we get bleeds in the neovascularization of the retina. As you get new vessel growth in the retina, they start to bleed, they start to leak, and that thickens the retina, and you start to get cysts. And this is what it looks like. That's the result. So I mentioned we've got 2 2 current treatments. We have this one, and we use this one. This is laser ablation. And you can see these are laser burns. It's a little bit like the Somme. You get a lot of very small laser burns over a few millimeters square. And basically what it's doing is cauterizing these leaky vessels, these bleeds. But the problem with this intervention.